Grazie.
Good morning. I'm Dr. Walter Rocca from the Mayo Clinic in Rochester, Minnesota. I am a neurologist and an epidemiologist conducting research here at the clinic, and I am very happy today to talk about a study which is going to be published by the journal Menopause. This study is addressing the question of whether estrogen is sometimes beneficial or always a risk for the brain in women. It is normally believed that estrogen is always bad for the brain because it causes blood clotting, which can then block the blood flow to the brain. But we were able to look at 7 studies, of which one is the one that we conducted here at the Mayo Clinic, and we discovered that by contrast, there is evidence that estrogen in young women may actually be protective or prevent the occurrence of stroke rather than being a risk factor. The study that we conducted at the Mayo Clinic involved a large group of women who had their ovaries removed when they were young, and we compared these women with women who had kept their ovaries in place. And we discovered that women who had the ovaries removed when they were young meaning below 50 or below 45, had an increased risk of manifesting a stroke. And we were very surprised because this was unexpected. But then when we looked at other groups in the United States and elsewhere, discovered that there is other evidence suggesting that that's the case. So we really think that the old idea that estrogen is always a problem for the brain has to be corrected. Estrogen can be a problem in older women, and we agree with that. But in younger women, we have to be careful that actually estrogen may be very important to protect the brain from these events. And this has, of course, implication for women that experience premature or early menopause, either because of natural reason or because they had a surgery to remove their ovaries. And these women should consider taking estrogen to prevent stroke and not to be concerned that estrogen would cause stroke. Of course, like any time we conduct a study and we are seeing some new pieces of evidence, we have to be very careful when translating these into practical advices. It's always important that women talk to their physician if they are in a situation where they may consider the need for taking estrogen or not, because of course there are benefits and there are risks, and these have to be weighted in each woman individually, and it cannot just be a single answer for everybody. So we would suggest that women who have experienced premature menopause, either below 45 or below 40, should discuss with their physician these new findings and inquire whether there's a good indication for taking estrogen at least up to age 50-51, which would then provide a lot of benefits and very few risks, so that the risk-benefit balance is for the use of the estrogen.